Tuberculosis in the homeless population, a Canadian community nursing perspective. This video aims to explore the relationship between homelessness and tuberculosis. The determinants of health and the Ottawa Charter for Health Promotion are used as a framework. An outline for the presentation includes a brief introduction, a look at the determinants of health, a review of the Ottawa Charter with a particular emphasis on the primary strategy chosen, an implementation of a sample strategy with its strengths and weaknesses, conclusion, and a formal reference list. Both TB and homelessness affect a variety of people, regardless of their age, gender, and racial or ethnic background. Homeless people are especially vulnerable to TB infection due to multiple determinants of health that we'll take a look at in a bit. Both TB and homelessness are present globally, its victims forming their own communities within the bigger population of individual cities and towns. Community nurses play a primary role in the care of these individuals. Income and social status. Insufficient income leads to poverty. Poverty is a risk factor for homelessness. When housing is not affordable, people are forced to survive on the streets or in appropriate agencies. Poverty is a risk factor for poor nutrition. When food is not affordable, people must eat little or no food and they become malnourished. Malnourishment causes a decrease in immune function, creating increased susceptibility to disease. A question for a community health nurse to ask herself would be, what employment opportunities and assistance facilities are available to the homeless population in my city? Social support networks. Several communities have TB clinics in operation specifically to monitor and treat TB patients in that community. Are these facilities accessible to homeless people or those without reliable transportation? What services are available for homeless people to access with regards to TB testing, diagnosis, treatment, and follow-up? Education. Lack of education is a risk factor for homelessness. People with low literacy levels are likely to be unemployed. Are we targeting the homeless population with education about TB prevention? How can we better reach the homeless within our respective communities with health education measures? Employment and working conditions. Homelessness is a risk factor for unemployment due to both lack of access to resources, such as resume distribution, transportation, etc., and social stigma. Unemployment is a risk factor for homelessness due to the increased risk of poverty. This forms a vicious cycle. What agencies are present within the community to assist the homeless with job opportunities? Social environment. Violence and crime can be a problem for people living on the street. Alliances forged under the common interest of survival can serve as beneficial social relationships among homeless people. Question for a community nurse to ask himself is, how can we provide human contact and communication for those ostracized by homelessness? Physical environments. Sleeping in close quarters, as many homeless do, increases the risk of TB transmission. Poor ventilation also increases the risk of TB transmission. Exposure to other homeless people who are also at an increased risk of acquiring TB is a risk factor for TB transmission. Personal health practices and coping skills. Unhealthy coping mechanisms such as substance abuse, smoking, and excessive alcohol consumption can be a risk factor for anyone, especially homeless people, due to the easy availability. These coping mechanisms increase the risk of immune system dysfunction, weakening the body's ability to fight pathogens. Personal health practices such as frequent hand washing are not always accessible to homeless populations, particularly in developing countries. Early childhood development. There are homeless children and families on a global scale. Growing up homeless can impact a child's education, literacy, nutrition, physical environment, and social environment, leading to an increased risk of homelessness as an adult. What agencies are in place within the community to educate homeless parents about childhood development and provide resources for homeless children? Biology and genetics. TB does not have a specific genetic component, and neither does homelessness. In terms of comorbidities, TB is responsible for about 23% of deaths in HIV-positive patients globally. According to a study done in New York, up to 1 out of 4 HIV-positive people are homeless. What are we doing to educate homeless people about HIV and TB prevention? Health services. Accessibility to health services is paramount to successful health promotion. Are there health promotion-based agencies accessible to the homeless population? Are the health services available to the homeless mainly health promotion-oriented or more diagnostic and treatment-oriented? Are there nurses going out into the streets to monitor the progress of TB patients and distribute masks and TB treatments? Gender and culture. While more men worldwide die of TB than women, there is no significant evidence to support that one gender is more at risk than another. Women to men ratio of homeless people in Calgary is estimated to be approximately 1 to 9. There is no significant evidence to support that one racial or ethnic background is more at risk of TB contraction than another. However, most of the TB population in Calgary is foreign-born, meaning not born in Canada. I could not find any evidence to support that one race or ethnic background is more at risk for homelessness than another, but based on personal experience and observation, the homeless population that utilizes cups in Calgary seem to be largely Caucasian and Aboriginal, with some other minorities. The Ottawa Charter for Health Promotion. Strengthening community action. This aspect focuses on getting community members actively involved in their health. Context includes schools, daycares, homes, workplaces, community centers, parks, etc. The end goal is to have community members display ownership of their health. Building healthy public policy. This aspect focuses on the development of healthy public policies within education, housing, social services, justice, and recreation within the community. It is based on the partnership between community members and policymakers. Creating supportive environments. This aspect focuses on increasing awareness of issues. These issues have been identified by the community as a strength or a weakness. It encourages participation in health promotion initiatives within that community, and it investigates the community's determinants of health. Developing personal skills. This aspect focuses on empowering individuals to make healthy decisions and practice personal skills that contribute to a healthy lifestyle. It involves providing information to the community and encouraging individuals to take action towards healthy lifestyle choices. Reorienting health services. This aspect focuses on promoting accessibility of services and interdisciplinary sharing of responsibility for the determinants of health. It includes engaging multiple sectors of the community to facilitate health promotion. The primary domain that I chose to investigate for this assignment was creating supportive environments. Some possible strategies for public health nursing practice include facilitating focus groups, collaborating with communities to determine their strengths and weaknesses, developing programs that are accessible and affordable and meet the community's needs, and promoting awareness of resources within that community. The following is an example of a community or public health nursing strategy and its implementation. It includes possible strengths and weaknesses. Prior to implementing and developing the strategy, you would need to do an assessment. In Calgary, a public health nurse could visit CUPS, the Drop-In Center, the Mustard Seed Center, and the Calgary TB Clinic. The public health nurse could organize a short focus group session at each location, ideally with some sort of incentive like a meal, and briefly interview the population about what they identify as strengths and weaknesses related to TB. For the purposes of this assignment, let's assume that in this assessment, the population agreed that they think the accessibility to the TB clinic is a strength, but they think the lack of educational resources about TB prevention is a weakness in their community. After the assessment, the next step would be to develop a strategy. With a focus of TB prevention education in the homeless population, begin to develop a means of education. Keep literacy levels in mind. A pamphlet alone may not do the job. Work with inner-city organizations to create designated seminar times for TB prevention education. Develop a budget for resources and incentives. The next step is to implement the strategy. Raise awareness of the sessions within each organization. Encourage attendance, which should theoretically be good as transportation wouldn't likely be an issue, and it was a self-identified area of interest for that community. Hopefully you found a way to provide an incentive. Facilitate discussion and interaction. Provide basic education about TB prevention. Inform clients when to get tested, proper coughing hygiene, hand washing, masks, etc. The final step is to obtain evaluation of your strategy. Ask for feedback from the community. They were the target group. Have their needs been met? If not, what would make a more successful approach next time? Measure learning by asking clients to repeat information, give scenarios, and ask what they would do. Ask clients if they would attend another similar session based on self-identified needs. Keep in mind that with a literacy questionable population, often verbal feedback will be much more effective than written. Strengths of a strategy like this include the following. The community self-identified the learning area as a need or an interest. You are giving them education. Knowledge is power. They now have the power to make educated decisions. Access. By facilitating sessions within agencies that this population already uses, you've eliminated transportation as a barrier. It may, over time, reduce TB incidence by empowering individuals to know when to go to a clinic to get tested and treated, and how to protect those around them. Weaknesses and limitations of a strategy like this include the following. The sessions may be poorly attended if the nurse has not already developed good rapport with the community. It may not be cost-effective if resources and incentives are not readily available. The homeless population is transient, so there may be large gaps in attendance, and the population that's reached may not always be the same population. It neglects non-English speaking populations, unless you can get a translator. In conclusion, community health nurses must always consider the determinants of health when creating health promotion strategies. The Ottawa Charter provides useful approaches to health promotion. I'd like to leave you with a challenge. What will you do to improve health promotion in your community? For a complete formal list of references, please see the information box.